Hello, this is John Kanellopoulos from our office here in Athens. Who would do LASIK on a patient who has one orb scan? This is the left eye of a lady imaged here in 2004. This is 14 years earlier with clear keratoconus. Let's click on the right eye. The right eye had much milder numbers there. We can see the irregularity, mild irregularity. Today, this pachymetry would be considered suspicious as long as the very high posterior float. Nevertheless, the surgeon at the time considered this a non-keratoconic eye, and she had LASIK in that eye for a minus 3.5. And let's click today. 14 years later, this is that right eye. We can see the thinned cornea with, of course, a much more advanced technology, the anterior segment OCT by OptiView, and the epithelial maps that show that there's no significant decompensation for the area where the mild cone was and where the LASIK has taken place. We can actually see some of the flap landmarks here on the cross sections, maybe seeing here the flap line. And let's look at the left eye today, 14 years later, a stable keratoconus. This lady now is 38 years old, and we can see thinned up cornea, but here we can see the epithelial response. So obviously the patient and surgeon got very lucky here. And the reason that I'm showing you these numbers is to show that even in high risk, LASIK may not necessarily induce ectasia. And the pearl here is that the patient is not an eye rubber. I would bet that with eye rubbing, she would develop full-blown keratoconus in the LASIK eye, which was her right eye, was considered at the time to be healthy. Nevertheless, we have patients that have normal keratometry, no family history of keratoconus, and have a routine LASIK procedure, and with eye rubbing developing ectasia. Just thought I'd share these data with you. This is John Kanellopoulos signing out from our office here in Athens. Thank you.